Welcome to our guide on postoperative care following implant surgery. It's crucial to follow these instructions to ensure a smooth recovery and minimize complications. Let's start with some essential tips to protect the surgical site. Protecting the surgical site. Avoid stretching your lips with your fingers to the surgical site, as this can cause trauma and introduce bacteria to the surgical site. Keep your head elevated at all times, even during sleep, by putting 2 pillows behind your head for the first week. Replace gauze every 20 to 30 minutes until bleeding stops. It's normal to spot blood for the first 24 hours. Do not eat, drink, or sleep with gauze in your mouth to prevent choking hazards. Contact the office if bleeding is extremely heavy. Do's and don'ts. Do not swish or spit aggressively for the first 24 to 48 hours, as we want to maintain the blood clot over the healing site. Do not excessively touch the healing abutment or temporary tooth attached to your implant with your tongue or electric toothbrush. Do not use an electric toothbrush directly over the implant site until implant has confirmed to be integrated, typically 2+ months after surgery. Do not water pick for 3 months on the surgical site. Do not drink alcohol for 1 week. It can interact negatively with medications. Do not smoke or vape. It can void all Ueno Center warranty. If Stella Life Recovery Pack was given, use is directed on the side of the box. If chlorhexidine was given, use 2 to 3 times a day for 1 week. Stop after 1 week. It can stain teeth. Use a soft post-op brush only on surgical sites, starting the morning after surgery. Brush only the teeth and not the gums in the surgical site. Continue water pick as normal outside of the surgical area. Resume normal brushing on the surgery site with your standard device after 1 week. Discard your soft post-op brush following post-operative visit. Sutures will dissolve on their own within 1 to 4 weeks. Be aware. Signs of infection may include increased swelling after 72 hours following your surgery. Membrane exposure. After 4 to 6 weeks, notify us if you see the white membrane exposed, used to protect the bone graft, on your surgical site. Sinus graft. Avoid blowing your nose and use an OTC nasal decongestant for 10 days to prevent sneezing. Try not to sneeze. If you must, keep your mouth open to prevent an increase in air pressure in the sinus cavities. Swelling. Use ice packs externally around the surgical site for 20 minutes on and 20 minutes off for up to 72 hours, at least 4 hours a day, with the first day being the most important. Do not place ice packs inside the mouth. Maximum swelling and bruising occurs 72 hours after surgery. Bruising can have various colors and may travel down the neck or up the cheek as it heals. If swelling or bruising persists after 72 hours, switch to warm compresses. Medications. Antibiotics. Complete the full course of antibiotics if prescribed. Discontinue if you develop hives or a rash. Contact the office immediately if needed. Pain. Expect pain or discomfort after surgery. Follow prescription instructions for pain medications. You may take the narcotic and Motrin together if prescribed. Rest. Get adequate rest. Avoid strenuous activities and heart rate elevating activities for 3 to 5 days. After the first 72 hours, you should start feeling better each day. Visit our website at www.uenodentalcenter.com or contact the office if you have questions about your progress. Retainers and temporaries. You can typically wear your retainer 1 to 3 days following your surgery. There should be no discomfort or pressure when you wear your retainer. If you do feel any discomfort, contact us so we can make an adjustment. Implant temporaries if applicable. If you had a temporary tooth fabricated at your implant surgery, inform us if you feel pain, pressure, or a high spot on the temporary when you bite down. Additional adjustments may be necessary, as there should be no forces on the temporary during implant healing. Diet simplified. Dietary suggestions following surgery for the first 14 days. First 24 hours, consume cold or room temperature soft foods only. After 24 hours and up to 14 days, introduce lukewarm, mushy foods. Avoid nuts, seeds, berries, crunchy foods, and hard bread for 1 week. Minimize extremely spicy and acidic foods. Chew on the opposite side of the surgical site if applicable. Do not use a straw until your post-op evaluation. Thank you for watching our post-operative instructions video. We hope you had a wonderful experience at our office. For further inquiries, please contact us.